Our next presenter, Dr. David Sweat, also happens to be the chair of the board for the Memphis Area Prevention Coalition. I've had the pleasure of working with him in his previous role as head epidemiologist for the health department. He is the one that I always call before I have to do an interview to make sure that I can confidently spout out numbers and they are correct. And they always are. Currently, he is the deputy director of the Shelby County Health Department, and he is going to present to you the opioid misuse disorder epidemic in 2020. David, are you there?
Yes, Josh. Good morning. I'm here, and thank you to everybody.
Real quick, about 10 minutes before, we're going to use Q&A for the questions, and I will put the link to the evaluation in the chat box and let you know when I'll do that. Thanks.
Great. And thank you, everybody, and good morning. Thank you for the opportunity to talk to you about our, really, I'm going to talk about a couple of different things today. I'm going to talk about certainly the data trends over the last year compared to this year to last year as far as the opioid misuse disorder epidemic in Shelby County, but also talk about the intersection between the COVID-19 epidemic and the opioid or substance use epidemics in Shelby County, and some things that we have observed that maybe are concerning and some lessons we can learn then and maybe apply in the future from this synergy. So once again, just happy to be here and thank you. I'm going to go ahead and share my screen, and hopefully you are now seeing some slides. I'm going to take this from the beginning. So we're going to be comparing opioid data for 2019 to 2020. And I want to thank Rachel Rice, one of the epidemiologists on our staff who helped compile or pull this some of this information together for me. And she has replaced or is in the process of replacing Courtney Sarah, who was our first opioid epidemiologist in Shelby County. During the summer, Courtney, who many of you may remember, moved back to Minnesota with her family, and as her husband took a new job, and we're happy that Rachel will be operating in that capacity going forward. So if you don't know Rachel Rice yet, you will get to know her, and she did help me with these slides. So we are going to talk about Shelby County and our local opioid epidemic. We're going to look at some data from the medical examiner system at West Tennessee Forensic Center. We're also going to look at some data from our emergency department monitoring platform, which is Essence, which lets us see what goes on as far as people coming to the emergency department with overdose events across all of our hospitals. And we'll look at some data from ODMAP that is put in by us and by the fire departments and police departments throughout the county. We'll look at the May surge, and we'll also look, as I said, at the context, all of this going on in the COVID-19 epidemic or pandemic. So as you know about Shelby County, we have, as far as the COVID epidemic, we have this week crossed the 35,000 diagnosed case threshold, and on October 20th, we had 227 new cases reported, but that's kind of our average number of new cases being reported per day. But let's take a moment and look at the epidemic, if you don't mind. This began for us in Shelby County on March the 7th, when we had our first diagnosed case. And since then, we went through many different phases. In early or mid to late March, that was the period of time when a lot of schools were on spring break or headed into spring break, and they made the decision not to reopen the schools because of the COVID epidemic. And then beginning just before around the 27th, 28th of March or so, or 25th of March, we went into Safer at Home, and we were under Safer at Home orders for 40 days. And we were trying to control the spread of the virus and drive down the reproductive rate of the virus, because our case numbers were doubling very quickly at that point in time. We were doubling our case numbers every 4 to 6 days in terms of the number of reported cases, and our reproductive rate for the virus was above 2. So meaning each case was creating 2 new cases. So after 40 days of being under safer at home orders, we had been able to drive the reproductive rate of the virus down below 1, meaning that each case was creating less than 1 new case. We were shrinking the epidemic. Our overall positivity rates were lower. They were around 4.5% on people testing positive, and we began to reopen. We reopened initially under what was called phase 1 back then, and then there was not any observed major impact from beginning to reopen at the beginning, and went into phase 2 right at the end of or middle of just before, really just before Memorial Day, we went into phase 2. And unfortunately, what you see is during the phase 2 of reopening and following the Memorial Day weekend and heading toward the July 4th holiday, we had rapid increases in COVID transmission. And our case rates were going up, our positivity rates were going up, and heading into the July 4th holiday, we knew that we needed to take some measures to pull back a little bit on terms of what our control measures were able to operate with. And at that same time, around the 4th of July, the city of Memphis issued their mask ordinance, and Shelby County Health Department issued a health directive requiring people to wear masks across Shelby County whenever out in public. And we really believe that that was one of the major interventions in the epidemic. Initially, we were seeing compliance levels only about 50%. Only about half the people were wearing a mask. The other half were not wearing a mask when we did observational studies at baseline using students from the University of Memphis to help gather that data. But after the mask ordinance and mask directive were put in place, we saw compliance with mask wearing go up to above 90%. It was around 96% on subsequent observational studies, and our numbers began to improve. We also did at the right around the 4th of July issue the orders to close limited service restaurants and bars, and reduce the number of places that people were just hanging out, and reduce the opportunities for the virus to find new hosts. And it began to drive the numbers down. Now, we got to a place in early September, right around or heading into the Labor Day weekend. We were worried because of our experiences with both Memorial Day and 4th of July. Would the epidemic be re-energized by Labor Day? And we did see an increase in the number of cases diagnosed following Labor Day, but not the dramatic increase that had occurred before. So we had a little bump, and then it started going back down again. And then in late September, heading into October, several things changed. And now we are back in a phase of growth of the epidemic. And so the reproductive rate of the virus is back above 1. We had managed to stay under 1 for more than 35 days. And but now we are back in a phase where the epidemic is once again growing. And that's not just a local phenomenon. We're seeing that across Tennessee. We're seeing it across the United States, that the fall wave of coronavirus is hitting everyone really hard. So, but overall, we've had so far as of this week, over 550 deaths, 556 on Monday, representing about 1.6% of the people who had been diagnosed with COVID. And the median age is 73 years of death, but that means half of the people were 73 years or older. Half the people who have died have been younger than 73 years. The total age range of deaths encompasses 13 years at the young end to 100 years at the top. But only about 1.6% of the diagnosed cases have died, but that's still over 550 people. And so that's the context that our opioid misuse disorder epidemic has also been going on, is in this context of a pandemic. And obviously back when we were under safer at home in late March and April and early May, a lot of the things that people rely on to help them with their addiction were disrupted. So meetings weren't able to be held in person. There were many other kinds of interventions that people rely on, or behaviors and networks of social support that became disrupted as a result of the epidemic. And the entire community had to begin to figure out alternative ways of operating. Also, during Safer at Home, things like the needle exchanges or the stop events and other public facing opportunities had to be shut down, and we had to rethink how to operate those and make sure that those could operate safely. So there was this disruption in March and April of our normal activities. And right now, this week, we have over 2,200 active cases that have been diagnosed. And we believe that that represents anywhere from 6,000 to 15,000 individuals who are actively transmitting or shedding COVID in the community. We certainly don't believe that the majority of people who are infected with COVID get diagnosed or seek treatment, but it could be, at the low end, it may be 6,000, 6,500 people, but a more likely estimate is somewhere around 10 to 15,000 people probably have COVID-19 in Shelby County right now and are shedding the virus. Switching over to our opioid data, what do we see in the opioid epidemic and how does it compare year to year? What you can see is at the bottom of the chart, this is looking at data from January through September of both years, that overall in 2020, we've observed a 24, almost 25% increase in fatal overdoses in 2020 when compared to 2019. And for most of the months, those increases, each month has been an increase over the previous year. There's really only been 2 months where we had a lower number of fatal overdoses in 2020 than we observed in 2019. And those 2 months were July, where we had a 7% decrease compared to the previous year, and then again in September, where we had a 7.7% decrease. But the key months that were really hard for us were May and June. So in May, we had 50 observed overdoses, fatal overdoses, compared to 27 the prior year for May. That's an 85% increase. And then in June of 2020, we had a almost 62% increase in fatal overdoses compared to the previous June. So those months in particular, May and June, were the months that we got just absolutely hammered with fatal overdose events. When we look at this, trending it back to April of 19 and bringing it up to where we are now in September of 2020, you can see that spike, that increase in April, May, and June. And remember what I said, that we were in that period of April, a lot of things were being disrupted, things that perhaps people were relying on. But the other thing that happened around that period of time in late April, early May, is people received checks from the government, from the federal government, to help us with our expenses due to economic disruption from the COVID-19 epidemic. And there is some anecdotal evidence and some statistical evidence that once that money got into people's hands, that the seeking of fentanyl and seeking of opioid related drugs and overdose events associated with that went up. And so we are, it came back down, like I say, in July, was a little bit, about the same as the prior year. And then it went back up a little bit more, but we're on par now, actually, with about where we were a year ago before the epidemic started in terms of our experience of overdose deaths. Now, when we look at our death data, the suspected fatal overdose deaths per week, in 2019, we were averaging about 6.6 fatal overdoses a week. And in 2020 through September, we're seeing about 7.7, so an increase there. The least amount of deaths in a month in 2019 was 3, and in 2020 year to date 2. The highest in 2019 was 15, and the highest in 2020 is 14. But overall, there's just been some increases. And when we look at this, lining it up on a bar graph week to week, what you can sort of see for the 2020 experience, those weeks that were 17, 18, 19 through 21, 22, that's that period of time that we're talking about in late April, early May. But when you get to this part of the year, last year, we actually were in a spike, deaths by week in 2019, and 2020 right now compared to where we were a year ago, we're very similar, but it was worse in 2019 for the fall. Now, when we look at these death data by age groupings, what you can see is that the demographics of fatal overdoses in 2019, it was more widely dispersed evenly. Whether we had, in terms of counts, we had between 60 and 78 deaths per age group, everywhere across the board, from 21-year-olds through 59-year-olds, slightly lower for the people over age 60 in 2019. But when we look at the distribution of deaths by age in 2020, it's very, very clear that adults 30 to 39 have been hit more heavily or harder, but the 20 to 49-year-old age groups collectively have been where the deaths have been concentrated, is in that group. But as far as other kinds of demographics of male, female, black and white, the distribution patterns between the 2 years, as far as fatal overdoses, look very similar. Percentages are very similar between the two time periods. Now, when we look at our emergency department visits, what you can tell is that we, in April of 2019, we had probably about 70 emergency department visits for overdoses, and that went up in May, above 100 a month. We sort of peaked in January at just under 160 and came back down. And then as the epidemic hit us in March, April, and particularly in May and June and such, the number of emergency department overdose visits really spiked. And May of 2020, we had more than 180, between 180 and 190 overdose events in the emergency department in the month of May. And that was a bigger increase. And although the numbers are beginning to come down, we're at a higher level now than what we used to be in 2019 for the number of emergency department visits related to opioids. And we've, as many of you know, we track spike alerts, or at least we did pretty consistently until Courtney Sarah left. We had somebody who was watching and giving us spike alerts, and we had some major spike alerts in May and June. And there were multiple overlapping alerts. So we had 419 total overdose events with 70 fatalities in the month between April 18th and May 18th. We had a 30-day alert with 423 overdoses, 68 fatal between April 22nd and May 22nd. We had a 30-day alert for the period of April 23rd to May 23rd, 429 total events, 66 fatal, and a 2-week alert in May, 215 total overdoses, 38 fatal overdoses between May 4th and May 18th. And all of those were statistically, alert level actions or things that we observed, spikes that were statistically significantly higher than should have been. And when we look at where did these spikes affect, what parts of our county were most affected, clearly Memphis proper was more heavily affected by that. And we were getting as many as 40 overdose events in some of our zip code areas during the spikes in May and April and May. And as we look at the spike alert that ended with May 30th, that moved a little bit more also into the area around the University of Memphis, just a little bit north of that, and then just around the Hickory Hill area, sort of you see also some higher levels of overdose events. But that's kind of the pattern that we saw, that it was really in the core of the city of Memphis is where we were having the highest levels of overdose deaths and overdose ED visits were being produced. And when we look at it overall, you do see that 90.5% of the overdoses during the surge came from Memphis. And that certainly we had participation from other communities, but almost, more than 90% were in Memphis proper. And, what we have seen with that is in the prior year or the past 2 years, we had sort of migrated from a Memphis focused epidemic into a more dispersed epidemic that was affecting a wider number of communities. But during coronavirus pandemic, we've seen it sort of pull back into Memphis more heavily with the number of reported overdoses and observed deaths. Now, when we talk about ODMAP data, this is all overdose events that were responded to by law enforcement and fire departments, and also the ones that were fatal. This graph is not intuitive immediately, but let me walk you through it. If we go back to April of 2019, we were having, in a 30-day period, we were averaging about 300 or so overdose events. And then as we went through the year, there was a bit of an increase at the beginning of January and February, where it moved up to from a baseline of around, or an average of about 300 overdose events per month, went up to about 350. Then it declined some back to normal levels. And then in April, it really took off. And we peaked around the May 30th timeframe at about 450 overdose events that month, in the month of May. And then we've come down from that high level, but we've reached a new plateau of about 400 overdose events being reported per month. So we went from, at a baseline level in late or the summer of 2019, we were averaging about 300 overdoses a month. Now we're averaging 400 overdoses a month. So we've gained about 100 on average more overdoses each month than what we were previously seeing. And that's even after the alerts, that's after the alerts and the period of the worst impacts in April and May. Now, the data that we rely on for this is coming from ODMAP and largely from fire department related data that was uploaded in the system. And that data engine has been disrupted in August of 2020 when the fire department switched their vendor for their CAD program and their ticket program for running fire department runs in response to 911 calls. And so the new vendor is in the process of developing the interface to ODMAP so that their system can upload those events just like the old system used to, but the what's called an API, it's in development, it's in testing, but it hasn't been turned on yet. And so we have not been getting the regular feed anymore from the fire department of the overdose events since around August the 26th. And once that new API is in place, we are confident that the data stream will be restored, but that's kind of the last good data we have about the overdose events overall. Everything that we can track right now consistently and compare to prior experience is really only the fatal data that we're getting from the West Tennessee Forensic Center. And that was the data that I was sharing at the beginning. So overall, what do I think that we've learned from this? I think one of the big lessons that we've learned, and I don't know, Josh or others may have some anecdotal evidence to throw in on this as well, is that there really was an adverse impact from a well-intended and necessary response to the COVID epidemic, is that the payments, the direct deposits that came out to help people economically also did fuel an increase in drug-seeking behavior and misuse of opioids, which had some fatal consequences for us and created a big spike in April and May. And the part of that plateau that's been held up of the 400 cases per month, one of the things we do not know, but it's at least a potential, is that the higher level of unemployment benefit payments could potentially have been contributing to people's access to have money to go buy opioid related substances like fentanyl. But with the ending of those higher level of unemployment benefits, we don't know yet, because we can't see the data right now, whether the numbers of overdoses have changed and moved in a downward trajectory. But if there's a new Congress that comes in 2021, if there's additional payments that go out to help people with economic hardship, we might be on the lookout for a potential of resurgence or new spikes that would be generated because of that. So that's just something that we need to keep in mind as we go forward. What I am happy about is that after the stay-at-home orders, we were able to resume having in our community the stop events. There have been a number of those. We've been able to help the needle exchanges and other services on the street resume with social distancing and proper masking and operate in a safe way. And those services are back available to the community. We've just had to learn how to operate differently because of COVID. And with that, I'll stop and take any questions if people want to pose questions, or if there's people who have other data or other observations that either corroborates with this or maybe disagrees with it. I mean, certainly feel free to share it.
All right, so you guys can put your questions in the Q&A function on Zoom, and David will be happy to answer them. I'm going to go ahead and send the link to the evaluation, and that should be in your chat box. So, David, you mentioned if about a second round of stimulus that we may see another spike in overdoses. What do you think we could do preemptively if we know it's coming out in the community to try to prevent these numbers from jumping up like they did last time?
Right, and this is something I think that as an entire community of providers and folks involved with this, I mean, let's think about the context of what happened before and then how can we mitigate it. So one of the things that happened before is meetings that used to occur in person stopped occurring in person, but maybe we had not necessarily established the virtual meetings. So people were more disconnected or isolated. And so I know that I've heard that there are many meetings now that are operating pretty well in a virtual way. But the main thing we know, like what battles addiction is connection, right, with others. And so how can we provide the social support in a virtual way if we know that that's coming, so that people don't feel so isolated? And I think that's one question. But I think that I would turn it around and pose it to the whole community. What do you think? What observations do you have? First of all, do you think that that's true, that the stimulus payments maybe increased access to or use of substances? But then what do you think would make a difference now? And I would pose that to the whole community as a group, because I think it's something we really have to think through. Now, I don't know whether there will be any more stimulus payments, or economic assistance, but if it does happen, I think we do need to be thinking about that.
Yeah, I actually was told by many people, doing direct street outreach, that their loved one received their stimulus money and left treatment, or that they disappeared when it got there and they haven't seen them in 4 days. So I think there's a definite correlation. Next question: are the rates of homelessness also going up if people are spending their stimulus money on narcotics?
That one's a little more difficult. I do not have a lot of good data about the number of people who are experiencing homelessness and how that has either gone up or down. So I don't know if there's other data streams that address homelessness, but that's a question I'm not certain of. But it's logical, right, to think that there could be some increase in homelessness because of people losing jobs, but I don't have any good data on it, so I can't say for sure.
Okay, and Rachel Pace is asking, do you have any statistical data on the relationship between stimulus checks and purchase of opioids that you can share with us, or is it strictly anecdotal?
It's mostly anecdotal. I don't have any hard numbers on it. I mean, we just know that they correlate in time. We saw the spikes go up at the time that, or right after the checks went out, but I don't have anything more than that observed correlation.
Okay. Anything you'd like to discuss while we're waiting on questions to come in?
Anything I'd like to discuss? Well, I think I would ask.
Actually, I've got one for you, David.
Go for it. Yeah.
What are your projections for the opioid crisis in the county and the nation?
Well, right now, I think we're on a plateau. We're just at a higher plateau than we were. And as far as the national data, I'm not sure. But what I'm worried about is that we are stabilizing at a higher level of overdoses than what we had been experiencing before, when obviously the direction we want to drive it is downward. We're not making progress. We're not going down. We went up and we've plateaued, but we've plateaued at a higher level. So I think for the duration of this epidemic, that's possibly where we're going to be. And that when the epidemic is over, we're going to have to do even more work just to get back where we used to be, let alone make more progress. So I think that the work that everybody's doing and the fact that you're here in the summit and the activity levels of the Memphis Area Prevention Coalition and all the other partners that are working on this are super important. But I feel like we're sort of treading water right now, and we're not necessarily making, we're not driving the numbers down.
Okay. Lauren Buford asks, have you evaluated the harmful effects of isolation due to COVID-19 as it relates to recent trends?
No, no, we haven't gotten any, I mean, we don't have any good way of doing that. I think one of the other things that's problematic, of course, is it's only been recently that we've been able to allow the health department staff who had to be redeployed into the COVID response to go back to their normal jobs. And so across our agency, the health department, we had a lot of people who were working on opioids or other community issues, dental, food safety. I mean, just up and down the line, vaccine preventable diseases, we had to pull people out of those normal activities and use them to work against COVID for March, April, May, and June. So for 4 months of the year, a lot of things that we were already engaged in sort of were pushed to the back burner for a little bit. And then we were able in July to sort of redeploy most of those staff back. And right now, most of the people who were deployed to COVID have been able to return to normal work, but not all. And then some people left their previous jobs to accept assignments with the COVID response unit. So, we lost ground inside our own agency. And I don't know what the impacts in other agencies have been, but I can imagine it's been disruptive, right? And so I think that's part of the problem too, is that people working on these responses have either had their work patterns disrupted by the epidemic, or in our case, we had to sort of take a pause for a minute and deal with the epidemic until we could hire some new people to dedicate to that. And I think that also contributes to why we're not making more progress right now than we are. But as far as to the specific question, the harmful effects of isolation, I don't have a lot of good data on that right now, but it's obviously a concern.
Thank you. All right, Melissa Eisenberger asks, have you noticed a correlation between tax returns and an increase in opioid use as well?
No, that's a little harder to see because the stimulus payments obviously all came out, or the economic assistance payments. I really don't like using the word stimulus. I know that was what the national word was, but it's really economic assistance payments. They all came out at once, whereas tax return, that begins in February. And this year went all the way up into July for people to file their taxes. And so you didn't get those, if you were getting a refund, you didn't necessarily everybody get the refund all at once. So it's dispersed over time. And so it's harder to see that, the impact of that.
Gotcha. Is there any data in the increase in age-related use to the COVID pandemic and kids needing to be quarantined?
I don't know about that. What we see is that 30-year-olds, people between 30 to 39-year-olds, are having more fatal overdoses this year than before, and that the age distribution is not as even as it once was. Now, 30-some-odd-year-old individuals obviously are a prime age group to have school-age children, and but we don't really know. We haven't been systematically collecting up until this point information about the fatal overdoses, whether or not they had children, and whether or not those kids. I mean, school was out for most of this epidemic. It's only recently started to go back in late August and September and October. But when we were having the big surge in May and June, school was closed. So kids weren't on virtual school, but they were at home. But I don't know that we have any good data about that.
Melissa Kelly asked, have the increased rates of overdoses related to the pandemic been communicated to government officials, and what does that process look like?
Well, it's certainly what the alerts went out in April, May, June, right? We sent out a number of alerts and many government officials were receiving those. But of course, the opioid epidemic was also uppermost on people's minds. So to what degree did people focus on that? I don't know. The information was shared. And then, I'm sorry, what was the rest of that question?
What is the process of notifying?
Process? Right. So when we see a spike, of course, we send it out to all the partners and the entities, the mayors, the fire departments, all the agencies, everybody on the distribution list, the police departments, everybody gets that. So we share that information, and then because like I said, we had to redeploy staff, including Courtney Sarah, into a lot of the opioid work in April, May, and June. We weren't getting our website as up to date or keeping it as up to date as we normally would. And if you look on our data on our website right now, it's behind in terms of getting information updated on there. But that's one of the first things that Rachel's going to be working on between now and the end of the year, to try to bring our data on the website up to current as much as possible. So I think that those are the kinds of impacts the epidemic has had. It's just sort of disruptive.
Gotcha. How do you use the data to inform a community response to the opioid epidemic?
Right. So when we identify an alert level and the areas that are most heavily impacted by that, and we share it with partners, obviously what we're trying to do is provide data for decision making and response. And so some of the things that happens as a result of a spike in a given area is the coalition partners decide to target certain areas with stop events and outreaches on the street. And I know that the Memphis Area Prevention Coalition maybe hits the street with some increased outreach in those areas, and hopefully other partners take action as well. But we share the data so it's possible for people to have an idea of where to go. And I don't know, Josh, if you want to talk, or somebody from the coalition wants to talk about, like, from your side, when you get the alert, what do you do?
Well, when we decide where a stop event is going to be, of course, it's based on the overdose map. So we look at not only fatalities, but overall number of fatal and non-fatal overdoses in a particular area. And that is the area that we go and we set up. We offer Narcan. We try to get the word out ahead of time. We will partner up with a local agency in that zip code, and they usually help us get the word out locally. And then we involve media, as much media coverage as we can possibly provide. And we will go out there and distribute Narcan in that neighborhood and give people access to treatment. I don't think we've had an event where we haven't had at least 2 people come and want to get into detox or go to some form of treatment. So, and what we're looking at now is, I think we're trying to compare the data in those areas to when the events will be. And I believe that's in process right now to see, what kind of impact we're having in those areas. But access to that data of where the overdoses are happening is huge for us.
Yeah.
It kind of dictates what we do.
Yeah. So other questions?
Oh, yeah. We got about 9 minutes. So
Sure.
And this is a good question. How much has the opioid crisis cost Shelby County financially?
Yeah, so we were doing some economic analysis of that and need to come back to that. We did meet with a health economist at the University of Memphis, and we we got some formulas to help us calculate that, particularly related to the fatal overdoses. Um, we need to update those calculations, and I've got a graduate student coming who can help us with some of that analysis in the next few weeks. But it's in the millions of dollars. I mean, because when we do that analysis, we look at it a couple different ways. We figure out based on the age of fatality, how many years of productive economic life are being lost, and then based on the residence zip code of the individual, what the median income is, and so there's a series of calculations, but it's staggeringly high. I mean, it's in the millions of dollars. And what is the lost economic contribution of an individual who dies? And of course, it's age dependent. And the younger you are, the more years of productive economic life get lost. But it is staggeringly high. And we're going to be trying to pick up that analysis because we were working on that right as the epidemic was hitting us, and so we sort of had to set that aside. But there'll be more information about that forthcoming, I think, hopefully by the end of the year or beginning of next year.
Yeah, the data that we have, I think 2017 was showing that nationally it's costing us $78.5 billion a year.
Yeah.
So it's quite a staggering amount of money.
Yeah. And when you put that number up against the maker of OxyContin just had an $8 billion financial settlement, which is a big number, right? But when you line that up against 78 billion every year in costs, that $8 billion settlement is quite small.
Yeah, I would say so. Is Shelby County receiving the needed support on a state or federal level to fight the opioid crisis as well as COVID?
Yeah. Yeah. Well, I mean, I think from just sort of taking off my Shelby County government hat and putting on my board member at the Prevention Coalition hat. I think we've been very successful in Shelby County in bringing dollars, in, whether there's grants that get made available from the federal government through the state to us or otherwise. Certainly compared to where we were 3 years ago, the amount of funding that has come to us to help support the work is more now, right? Now, is it as much as is needed? Well, I mean, we probably would feel that more would be helpful, but are we being successful in trying to bring dollars in to our community to help us with the work? I would say we are being successful in getting more dollars now than what we had 2-3 years ago, and we'll continue to do that. But the size of the challenge is very large compared to the financial investment by anybody.
Has the opioid epidemic been overshadowed by COVID?
Yes. I mean, in the media and in the national consciousness, it was prior to the COVID epidemic. I think the amount of time people spent thinking about substance use disorder was definitely on the increase and at a higher level. And the epidemic, being a worldwide pandemic and a public health emergency of a scale that we've never seen before in our lifetime, yeah, it's clearly getting more attention. I mean, that's just true.
Yeah, it seems like it really got overshadowed, and then we kind of saw the results of the shutdown and started seeing all these spikes, and I think, you know, the spotlight kind of went back on it at that point.
Yeah. Yeah. And, but, you know, um, it's not going to go away. And the, but the epidemic eventually will end, right? So our responsibility, what I believe our responsibility is to do as much as we can for as long as we possibly can to stay engaged with the issues and
Everyone's a liar. Yeah,
be prepared for the day when the epidemic ends.
All right, and one more question. There are a lot of students watching today. What would you say to specifically to them to the upcoming healthcare professionals that will be helping us fight this epidemic once they get in the field?
Well, I would say learn everything you can, right? Learn everything you can about substance use disorder, and it's a multifaceted problem, and the complexities are real. So learn as much as you can while you're in school. Be as prepared as you can be when you go into practice or go into public health practice. But recognize that substance use disorder is a medical condition. It's a disease, right? And so treat it as such, and then look for the effective treatment and effective interventions that have evidence behind them and weight behind them. Support those everywhere you can, and make appropriate referrals. I would definitely work on that, right? As you enter into practice, if you're a healthcare professional, think about the kinds of questions you need to ask your patients, and what do you need to be watching for that may be a indication that somebody has a substance use disorder, and then prepare mentally for and with resources to offer as referrals to individuals if you screen and identify an individual who has substance use disorder, and be prepared for that if you're a healthcare practitioner. But then if you're a public health individual, I would say just learn as much as you can about interventions that work, evidence-based practices, and how to view individuals holistically. I think that's the biggest issue is don't compartmentalize people. Look at people as a whole, and even if we're dealing with them in the context of some other issue, be aware of substance use disorder and be prepared to make referrals for help if we encounter someone, either as a peer, as a family member, as a colleague, or as a client. Be prepared with resources to offer.
Excellent. Well, David, thank you again for being here. I know you're the busiest man in Shelby County right now, so we really appreciate you taking time to do this.
No problem.
Hopefully I will see you soon, and we will see you here next year.
I hope so. Y'all have a good day.
Yeah.